Alright, here is my audience. Alright, my name's Alyssa and I'm currently a nursing student, and part of a nurse's job is to teach their patients. One of the most important and relevant topics to talk about is that of personal hygiene. It's your best defense against communicable or infectious diseases, all the way from the common cold to hepatitis. For something so preventable, a magnitude of people are afflicted with these diseases. How many of you have had the cold this winter? Some of you may have even had a few colds. In 2009, according to the Center for Disease Control, over 10,000 new cases of tuberculosis, over 30,000 new cases of AIDS, almost 50,000 cases of salmonella, and over 1 million new cases of chlamydia occurred in the U.S. Although these are not as serious as the cold, they're still communicable diseases. Tuberculosis, for example, according to story, is caused by Mycobacterium tuberculosis, and it's transmitted by inhaling infected droplets. It kills more than 2 million people around the world every year, and it affects your lungs. When the bacteria enter your lungs, your immune system attacks them, and it turns into a cottage cheese-like formation called a tubercle in your lungs, which is pretty nasty, and it's the treatment for that 6 to 9 months. To thrive, according to the Serve Safe Manager training book, bacteria like that need nutrients, which, depending on the type of bacteria, that can be found on your food, on your skin, or in your body. They need moisture, time to produce, and they can reproduce fast. They need certain temperatures between 70 and 120 degrees Fahrenheit is the best, and many need oxygen. Our skin provides bacteria with the moisture, oxygen, nutrients, and the perfect temperature. So the only thing we have control over is how long we allow them to stay on our skin. The rest is up to our immune system. Viruses don't even require as much as bacteria do. They only need a host, which again is something humans can supply them with. Viruses are non-living, and they enter our cells and use them to reproduce, making them really hard to treat. Hygiene is your best defense against both viruses and bacteria. The most effective and easiest thing to do is to wash your hands, according to Taylor, Lillis, and Lamont. Warm water and soap are most commonly used, but you can use antimicrobial agents like hand sanitizer. Barriers are another effective method as well. Condoms are used as a regular safe sex practice, so wearing gloves and when you handle raw food or something unclean like trash, or if you're working outside. You may also see immunocompromised people like cancer patients recovering from chemotherapy wearing face masks, which is a barrier against inhaled droplets that are infected with the flu or the cold. Other ways to stay well, according to the Canadian Centre for Occupational Health and Safety, include getting vaccines like your yearly flu vaccine or your childhood vaccines. Avoiding touching your eyes, nose, or mouth while out in public. These are portals of entry, and the skin is your immune system's first line of defense, so when they enter your mouth or your nose, they completely bypass that first line and they go right into your body. Staying home from work if you're sick also protects others from getting infected, but it keeps you away from new germs, and it also allows you time to stay at home and relax and get well. Another way to keep well is by cooking food thoroughly and washing your fruits and vegetables to get rid of any bacteria. In practice, there's 2 services in particular that use methods of hygiene, and I bet you're really glad that they do. The first one is the food industry, and the number one thing again there is washing your hands. Where I work, we have to wash our hands at least once every hour, but also after touching our face or our hair or something else dirty. They also must make sure food is cooked, cooled, and reheated correctly to meet the temperature requirements, which keeps away bacteria like E. coli and salmonella. You also must avoid cross-contamination, such as using a knife to cut raw meat, then using the same knife to cut fresh fruits and vegetables for a salad. And finally, excluding sick workers, especially those with diarrhea, jaundice, or vomiting, that prevents against diseases like hepatitis A or Shigella. The second service is healthcare, and you should be very glad that they use precautions of hygiene. Healthcare professionals use the basic precautions for all patients, which keeps themselves, that patient, as well as other patients safe. Hand washing is, again, the biggest thing to keep clean. Standard precautions are also used while working with any patients, which would involve gloves during a physical examination, or if they're giving you a shot, they would not recap the needle, but they'll put it in a sharps container, which prevents against bloodborne pathogens like AIDS or hepatitis. Transmission-based precautions, such as contact precaution, is where anyone working with a patient who maybe has something like MRSA, which is a penicillin-resistant skin infection that's highly contagious. Anyone visiting or working with the patient would wear gloves and a gown, and the patient would have to stay in their room. They couldn't go out into the hallway. Also, medical workers use surgical asepsis when dealing with any procedure that needs to be completely sterile, so no germs can get in the body. That would be for things like surgery or procedures like catheterizing a patient. As you can see, it's extremely important that workers who deal with food and patients use good hygiene, so it's also important for you too. Some of the things you can do are washing your hands. That's, again, your best line of defense. You want to use condoms, so it's another barrier method. And you want to get your yearly vaccines, like the flu and your childhood vaccines, as well as rinsing off your fruits and vegetables and cooking meat thoroughly. This is very important, so it's your best way to prevent against communicable disease. So thanks for listening. And